For the first time, I stood up and actually thought, this is dangerous what I'm doing now.
I wish there was something I could do to help, but I can't think of anything I could do.
I've always wanted to give something back.
This is the biggest challenge that the ambulance service has ever had to confront.
I'm scared no matter what precautions you take.
I can't live each day wondering what's going to happen. You kind of just have to live in the moment.
During those bad jobs, it's actually OK to say, I'm not coping very well.
He's positive for COVID.
COVID-19 has changed all of us.
People have stood up. People have made some real big sacrifices.
My life has completely changed. I'm on my own.
Physically, you can't see anybody, you can't hug anybody. That's been hard.
I'm worried about my mum and my children. Am I going to bring it home to them?
I just hope I get it right, because it's somebody's life at the end of that call.
We have absolutely seen the best. And it starts with our frontline staff.
I'm not a hero. This is what I said I would do.
Are you all right, you two? You all right, Dad? Lovely to see you. You both okay? Good, yes, yes. Don't make me cry then. Oh, what have you got, mate? Oh, thank you so much. Really? Thank you very much. Oh, that's lovely, thank you. Oh, goodness. Oh, I adore my mum and dad. My mum and dad help me with childcare all the time. My dad's got Parkinson's, but he still works as a lollipop man. He's amazing. My mum works part-time as well, so both still work, but I'm really, really close to my parents. And there's just me at home with my children. So, we're really close. Are we 8 o'clock yet or not? Oh, we're 8 o'clock, guys. You feel almost uncomfortable, to be honest. Being clapped, it just makes me feel a bit embarrassed. I'm clapping for my colleagues, all the hospital staff, people delivering you food, people delivering you parcels. High five.
And what about all the carers that are going in people's homes or that are working in the care homes? They're stuck there the whole of their shift. They're not going anywhere else. They're just with those people, putting themselves at risk just as much as the rest of us. That was the big one for me. I was clapping for them. Don't want to squash the flowers. They're beautiful, aren't they? It's the last thing I want. They're lovely. Thank you so much. I'd love to give you a hug, but I'll give you a virtual hug. Love you both so much. Love you.
This is the worst public health crisis for a generation. I must level with you, level with the British public. Many more families are going to lose loved ones before their time.
Just bear with me. How old did you say baby was?
4 months old.
4 months old, oh bless. Any coronavirus concerns?
Yeah.
And have you had a letter from the NHS advising isolation for 12 weeks?
Yeah.
And just let the patient know that our crew will be coming in with a full PPE just because of the COVID concerns there.
I've got a lady, she's refusing to drink and saying she wants to die.
OK, are you a nurse or are you a carer?
Senior care assistant.
Senior care assistant.
I joined in October.
So she's refusing to take fluids?
Yeah.
Started doing 111, and then in March, when coronavirus came, I was trained to do 999 in 2 weeks.
Is she known to have a mental health problem?
She has got cognitive impairment, but she is aware of what she's doing. She's saying she wants to die.
Has she planned on how she would end her life?
No, she's just saying...
I'm new to the role. I've made mistakes, and I probably still do, but it's just learning from them.
So what I'm going to do is get one of our clinicians to give you a call.
OK, thank you very much.
Take care and all the best.
Bye.
Bye-bye.
Some calls are harder to take than others, especially with everything that's going on now.
This is her third fall in 24 hours, yeah.
Has she developed one or more new marks, like bruising or bleeding under the skin?
I'm not too sure.
My parents were like, are you sure you want to do it? Because at home I'm a totally different person. I'm not very confident and I'm not very forthcoming. Are you calling about the coronavirus?
She's quite poorly, yeah.
To them, they were like, how are you going to deal with the calls? How are you going to act towards them? So, like, it's been a bit of a roller coaster, but I've got there. I'm just going to ask you a series of questions just so I can get her the best help, OK?
Ambulance service, is the patient breathing?
Yes.
And what's the reason for the call, please?
I'm calling for a care home in Warsaw. A patient has had a fall and complained of pain in the head.
And has anybody in the home had any symptoms of coronavirus? So any cough,
Yes.
or breathlessness, cold or
Yes.
flu? Yeah, okay.
We're off to a care home. They've had it hard, haven't they, to be
Yeah,
fair,
God,
the
yeah.
older generation.
I think the care homes, nursing homes and that have kind of been not given their due respect, really, I don't think, do you?
Oh, the staff are working wonders, aren't they? But
Honestly, it must be horrific for them because they've had a lot of deaths, haven't they, in those places.
Care homes are a society where people walk free, they have their lunch all in one room, there's a lounge area, they're all mixing in there. There's no keeping people in their rooms in a care home, that's not right.
Is he so breathless that speaking more than a few words is impossible for him?
Yeah, please hurry up.
Has she become breathless or more breathless than usual? Struggling. If you just bear with me 1 second, I'm just going to have a word with one of the paramedics that's in the room just because I'm a little bit concerned about her sats, okay, just to make sure I'm getting Shirley the right response. Okay, bear with me 1 second. Hello, it's Meg. I've got a 89-year-old COVID positive patient in a care home. A bit concerned as she's got a chesty cough. She's got no problems with her breathing, but her sats have dropped down to 88. It's a residential home, but they've been doing the sats and the temperatures twice a day just to monitor because she's positive. Yeah, of course can. All right, thank you. Bye. I used to work in residential nursing homes and in domiciliary care myself, and it can be, I suppose, frustrating because they're just as important as the hospitals because they have got the most vulnerable patients that they're looking after there.
Here we go again on our own. Medium, sire?
medium, please.
I do prefer these gloves. I know it sounds a bit weird, but I like it because I feel that you're more protected.
I don't like how short these apron strings are.
I know,
or
I
how
don't.
big,
Do you want
or
me
how
to do
big
it
my
for
gut
you?
is.
The main issue, I think, for the carers is obviously they're wearing PPE all the while. It's a massive barrier to communication for the, especially for the people with dementia. So obviously they can't see any facial expression.
Yeah. It's even harder, isn't it, I think? Good morning. Good morning, yes.
Pat, can I have a look at your head?
So what exactly happened, ladies?
Because you've had a little fall this morning, haven't you?
So he was fully conscious?
You're not in pain anywhere? I'm not going to hurt you, my friend.
No, man.
Are you in pain there where I press?
No.
What about this leg?
No.
Can I stick some sticky dots on your wrists and ankles, my darling, just to check if this sticker's working as it should be?
No.
Would Adam do it?
Yeah.
Pat, I'm just going to stick these stickers on your arms and legs.
Has he got family that come and visit him or anything? Oh, no.
Lovely.
Oh, goodness.
Let's take this off, shall we, Pat?
He said he's been isolating, however he wanders about freely, does he? Oh, has he been tested?
Pat was tested.
Oh, OK, sorry, when? Oh, he's positive.
Is he positive?
He's positive for COVID. So he hasn't got a temper.
Sorry, straight to
He's negative.
Oh, goodness. Well, there was a query.
It might be worth testing him again today, just to double check.
So you've got proof?
Oh, let's have a look, sweetheart. A lot of elderly people in care homes, they have been to hospital, diagnosed with COVID and then been discharged, and they take it back to the care home.
Just going to put these ones on your legs, Pat.
People are coming in and they've got symptoms of it, or even if they're silent carriers of it, it's just going to spread throughout.
Pat, do you think you could stand up for me? We'll get you a coffee in a second, Pat. Are you having some biscuits as well?
Yes.
What's your favourite biscuit?
Say bourbon, Pat. Don't let me down now.
Chocolate cream.
Chocolate cream.
So close.
Yeah, that's good.
Pat, for us to get you a coffee and some biscuits, we've got to see you up on your frame. We just wanted to see if you could walk down the corridor with us to grab a coffee, because we don't know where it is.
Give it some welly, Pat.
Push with your legs. That's it, you're doing really well. Keep pushing.
It's the care homes and the residents that need our help more than anything.
Straighten those legs.
Something needs to happen. We are just a short fix.
How many biscuits you having, Pat? Just a couple.
We'd like to think that we have a lasting impact in what we do matters to somebody and it makes a difference. But there is an injustice in all of it, really.
We had 5 deaths, so we had an outbreak. But as other homes lost 46 or more.
I know,
And we've not even been counted.
Are you all a bit low and burnt out kind of thing?
We've lost family, haven't we? It's really hard.
How are you dealing with it, as in like coping mechanisms and what have you?
We're just trying to cope at the moment.
So do you have any support? Do you have like a support network for yourselves or anything? Or is it just like staff pulling together?
No.
I really feel for you, to be honest. I do think you've been kind of missed out the loop.
That's our whole family out there.
Absolutely. We've just got to all pull together and do the best that we can, haven't we, ultimately?
Just be glad when it's over.
The government would constantly say the elderly are vulnerable, those with underlying conditions. That screams care homes. Yet they weren't prioritised at all. So that's why they've got the most prolific death rate, haven't they, in the care homes? That's why, because they weren't prioritised.
Lovely to meet you. You just look after yourselves, all right? You take care, sweetie.
It's like a silent fight they've been doing the whole time, isn't it?
The Foreign Secretary's warned we're not out of the woods yet. Dominic Raab says he recognises the mental strain the lockdown has on everyone.
People stuck at home, and the elderly more isolated than we'd ever want them to be. We are making progress through the peak of this.
Robin doesn't live at home. She made the decision at the start of the crisis to move out. She's my eldest daughter. She works as a paramedic for West Midlands Ambulance Service. She's currently living in a B&B that was offered free to NHS staff. She chose to do that really to protect us, her family. I'm a key worker. Her dad had bowel cancer and is still under investigation for other things. And her grandparents are very vulnerable. I'm proud, but I am scared for her with the exposures that they have. And I keep asking her, are you feeling all right? Are you feeling hot? Have you got a cough? This is a surprise that Robin sent me through the post. She's put missing you lots, sending a big socially distant hug. Love always, Robin. Yeah. Sorry. So far, she's healthy, and hopefully she stays that way.
You've always got that in the back of your head, what if I have got it and I'm asymptomatic, I'm not showing any signs. And if I were to just pass it on to any of my family members, it's just not worth the risk. I couldn't forgive myself, really, knowing that I'd been reckless with doing that.
My life has completely changed. I'm on my own. I've had to sacrifice living at home with my family. I can't just sit back and relax with my friends. However, the thought of not working and not going into work never crossed my mind.
COVID-19. I think they flagged this due to the patient's temperature, but they are also querying sepsis.
If you put your hand on your chest, does the temperature of your skin feels normal, warm, cool, hot to touch?
Have you spoken to your doctor about it at all, Peter?
Today I have had major trauma. I've had COVID, stroke, COVID, fall, major trauma, fall, mental health, RTC, unconscious, not breathing, COVID, and an overdose. Just a lot more of the more normal calls have all come through lately, so which is positive, I suppose, but there's still a lot of people that don't want to ring for an ambulance.
His brother's hung himself and he's unconscious.
So he's still hanging?
Okay, so he's still hanging, he's not breathing. Did he say he was actively hanging?
The police. Hi, it's, the ambulance service here. Is he still hanging at the moment? Yeah, is he not breathing? I need you to go back inside for me and I need you to go to your brother.
I'm struggling to put rope from there.
You need to cut him. You need to cut him free if you can. If anything that you can, that's there available. I need you to cut him free and completely remove anything around his neck. Don't throw it away as it might be important evidence, but I really need you to go and cut him free for me. Is he breathing at all? No. I know. We're gonna get him the best help we can. We've got a crew coming to you. We want you to try your best to try and get him free from that rope for me.
Okay, is the door open for us?
Okay, is the door open for the crew? We should just be pulling up outside for you now, okay.
Thank you, bye.
Just stay on the line for me until they come inside.
Please hang up.
That was the sad one.
As soon as you're on that call, tell them we need to get him down, because while he's hanging, he's got no chance.
Because I've just started the job, some calls still stay with me. It's just understanding how to cope with them. At the moment, I can't see my friends and I can't hug somebody or can't go home and explain to my parents, or, you know, this is what's happened. Can I just have a hug? That can be challenging.
As well as COVID being at the forefront at the moment of healthcare, people are still having heart attacks. They're still having breathlessness, asthma attacks. Trauma is still going on. There is still people falling off their bikes, falling downstairs.
We'll get this heating on for you, okay?
I know. That's what we're here for. We're not just for COVID response, we are here. We are an emergency ambulance. We are there for emergencies.
Are you in any pain at the moment?
Just a bit.
Just a bit?
Yeah.
Okay. I'll try and make it really toasty for you.
Good.
Yeah, whenever you're ready. This morning, this gentleman, he's had what we call a hypo. So he's diabetic, so his blood sugars have been very low. So an ambulance crew was called to him. However, whilst with the crew, he's had a cardiac arrest. It's later been found out at hospital that he's had a heart attack, an MI, which is why we're taking him to Stoke now. Unfortunately, if he had arrested when he was home alone, the outcome may not have been as good. Is your wife at home, Leon?
Yeah.
How long have you two been together?
Oh, 59 years.
Gosh, what's the secret?
Being fair with one another.
Yeah.
When we go to someone who is critical, I always think, you know, when was the last time they spoke to their daughter or their wife?
I would have thought it was doing as you're told.
We're taking people to hospital that are going to have life-changing procedures, and they're going to be going through that alone.
Do
Do you have any grandchildren at all?
I've got a grandson.
Have you? Okay.
I've got a granddaughter. She's at university.
Is she?
Yeah.
What's she studying?
Law.
Law? Oh gosh. I bet you're very proud of them.
Yes.
Yeah. We're the only one there for hand to hold on the way to hospital. And sometimes, you know, we're taking people in and it could potentially, you know, be the last time that they see their loved ones. And it's hard, it is hard, knowing that in the back of your mind. Sometimes it can be hard being in the medical profession. It can be quite scary, obviously, when you hear that your dad had this diagnosis of cancer. Your mind goes to those situations where you've seen patients, you know, at the end of their lives. I've been with my dad, I've been with him to his chemo sessions, and we're quite open to talk about it. He's never hid away from it, and he's always been supportive of when I was training for this job, and I just want to do him proud, really. Yeah. Oh God, I'm going. Yeah, I just want to do him, just want to make both my parents just really proud. Yeah. So, yeah. Oh God.
Anything urgent we need to deal with straight away? Steve, you're the duty director.
No, there was the West Midlands and Warwickshire call today. I think the highlights were, you'll notice that the care home outbreaks has gone up quite a bit. Finished last week on 270, they've gone up to 306 today.
Yep.
And therefore, there was a long discussion where the key theme was testing, and more testing. And by far, the priority for them was to get into the care homes. So,
this virus has been rampant through the care home sector. How do you deal with that? How do you deal with that?
They were deploying the military, so there's 6 military units gone live. As per the national news, 6 of those are live now within the West Midlands. There's still some reporting around test slots not being taken up.
It may not feel that way to the general public, and certainly those staff working in those homes, but it has been a real hot topic. And it starts with our frontline staff. It starts with our frontline staff.
Ambulance service, is the patient breathing?
Yes.
Yeah, and what's happened?
I've just gone down to give him his medication and I found him on the floor and he keeps shouting. He said his shoulder and his left side's hurting him. You all right, Fred? You still in pain? Yeah.
Are you calling about coronavirus at all?
Suspected.
Is it suspected in the home or with the patient?
Yeah.
Okay.
Thank you. Cheers.
Are you hurt anywhere, sir?
Left of my head.
The left side of your head?
Yeah, my left, my arm and back.
Is that your left arm?
Yeah.
I'm just going to have a feel of your head, Fred, and have a look. Just there?
Yeah.
Yeah, you got a bit of a lump there, haven't you?
Yeah.
Okay. Right, I'm just going to have a feel for your chest. Can you feel me touching you?
Yeah.
Straighten your leg for me. Okay. What's his temperature?
37.1 temperature.
Okay. I'm happy with his breathing. Pulse is regular. He's got central neck pain, so we're going to have to immobilise him. Fred, we're going to have to pop you to hospital.
Yeah.
All right?
Yeah.
Good, okay. So just bear with us then, and we'll get you up and get you in the ambulance, all right?
I ain't going to go and do it.
Has Fred shown any signs of COVID-19? Cough,
No.
temperature?
No.
Nothing like that at all?
He's only been with us a few days.
Oh, really?
Yeah.
Where's he come from?
He was a hospital discharge.
A hospital?
We haven't actually had residents go into hospital with COVID, have we? They've gone into hospital for other things, but when they've been tested in the hospital, they've been in there like a week, and then they've been tested and they've been positive, so we don't know if they've actually got it from the hospital or here.
I'm sorry, Frederick. I know it's not very comfortable. There we go, sir. Well done. Good man.
You get on with this.
Good. Fred, Julie says she's thinking of you. She's thinking of you.
She'll see you later.
I am very worried for him, yes. It's just such, it's so sad because he's such a lovely man. Considering his age and that, he won't let nothing beat him. He's a busting bloke. You okay there, Fred? You know I can't come and see you in the hospital, don't you?
I don't think he can hear you, darling. He's got a collar around his neck.
Oh, right, okay. Just worried that he's not going to be coming out of the hospital on his own. What a way to end his life. I mean, he's 86 in August if he makes it.
This town is looking like a ghost town. Who sung that, Ghost Town?
I believe it was the Specials.
The Specials.
You know the Specials,
From Coventry?
don't you? They're not from Cov.
The Specials was
No.
from Coventry.
Really?
Promise you.
You know this one. You know it.
This town is coming like a ghost town. All the clubs are being closed down. This place is coming like a ghost town. Bands won't play no more.
Basically, I'm calling from care home. One of our residents has presented with really bad symptoms of COVID-19.
I mean, she's so poorly that she stopped doing all her usual activities.
Yeah, she's hardly eating, she's not drinking, and as I say, we have been barrier nursing her on the side of caution because we've had active COVID on the unit she's on.
Ambulance service, is the patient breathing?
Yeah.
Is the patient conscious?
Yeah.
And what's the reason for the call? With some calls, I'm still not confident because every call's different. When I started, I was really panicky. The first shift I had, I couldn't get out of my car because I was that nervous. But then I made it in, and I'm here today.
Does the blood seem to be spraying or spurting out at all?
Just confirm that full address for me, just so I've got that right. Ambulance service, is a patient breathing?
Yeah.
Obviously, I'm from BME background, so knowing that I'm at high risk and can take it home, that's a bit scary because I wouldn't want to give it to my loved ones. My family are really worried about me coming to work because I stay with my elderly grandma. She sleeps in the same bedroom as me. I'm really close to her, so taking it home would be a major risk for me. I'm a huggy person. I'm a bit of a big baby, so my hugs mean a lot to me. So knowing I can't hug her or hug my mum or hug somebody else, that's been hard. Me and my grandma talk about everything, just about life. She was actually talking about how she's never experienced such a thing in her life where everything went on lockdown. So for her, she finds it a bit strange, even though she don't go out much because she's ambulance service. Is a patient breathing?
He is, yeah.
Is he conscious?
Yeah.
And what's the reason for the call?
She had a stroke not too long ago.
As soon as I go home, she'll ask if I'm okay and how was it today. I still don't hug her because of everything that's going on. She's more like a mum to me, so yeah, I can't talk now.
Sounds like you look after each other.
Yeah. Told myself I'm not gonna cry.
What does she say about you, the work you do?
She tells me to look after myself and make sure I come home safe. And she's proud of me, I suppose, for helping people.
Across Birmingham from the Hits Radio Network.
Captain Tom Moore has become the oldest artist ever to get a UK #1 single. The 99-year-old recorded a rendition of You'll Never Walk Alone for charity.
When you walk through a storm, hold your head up high. And don't be afraid of the dark.
Imagine you've got the hose pipe out. Wherever the water lands, could be virus.
Yeah.
Life's a chance, isn't it? I just get on with it and don't really think about it. But when I get home, I strip off, wash my clothes, have a shower. Yes, we have to get on with it. We have to help everybody out. My wife is actually probably more at risk than me because she's volunteered with the parish council, delivering food parcels to any of the vulnerable that need help. We isolated her parents over 80. March the 5th, I think it was, early. And my mother-in-law's just had the £1.5 million letter about stopping in. So they're extremely vulnerable. So hopefully they won't get it.
How old's your granddad?
70th. Yeah, he's this. Okay. Hi, Gunnar.
Hey, Tom. How's you?
I'm good, how are you?
I'm okay at the minute.
How you finding being locked in?
What you have to do, it's just the weather's not when you can get outside.
I know.
Out to the garden anyway.
What have you been doing?
Bit of gardening and getting the fence, stuff like that.
Do you worry about me?
They worry about you? Yeah, all the time. I know you know what you're doing and you look after yourself.
I have to wash my hands after the toilet now, Gunnar.
That's serious.
What are you missing the most?
Just getting out and about, going for a drive and going shopping, which I didn't think I'd ever say in my life.
You'll probably not see me for another year. I was meant to be coming home tomorrow.
Really?
Look, obviously can't get back, so then I'll be going back to uni. So, could be missing Christmas as well. I'll see you next year.
Look after yourself, stay safe.
I will, Granda. It's good to see you.
All the best.
Cheerio.
Bye.
Bye-bye.
Bye.
Bless him.
So I've got a category 3
Yeah.
to validate. 100 years old female. This morning she's woken up with lower limb pain and swelling. Trigger question is that she's unable to move one of her legs at all.
Oh,
A carer with her and a son with her at the minute, but you can hear her screaming in pain in the background as well. She's struggling.
I think that one's safe to send.
Yeah, I'll go with it, no worries.
So what's happened today, sir? What's been going on?
How are you feeling? About an hour ago, and then when I went up the road to fetch her back, she was here.
Yeah.
And she kept saying, get me up.
She been sick or anything? She been coughing like this?
She's been coughing, yeah. She's had a chest infection over.
She has she?
But she only came out of hospital a week ago.
Which hospital was that? City? Sandwell.
Yeah.
Her chest is just completely full. Top to bottom is just really congested.
Gladys, do you feel short of breath?
Somebody
Someone's
out there
at the
for
door,
you.
mate. Well, let's just see if this helps with your breathing, all right? You're struggling a bit.
I'm gonna have to pop you up to the hospital.
Right, where's Ron?
He's just at the front chatting to the neighbour.
We haven't got a lot of choice, Ron, unfortunately. We're gonna have to take her back to the hospital. You can hear the infection in her chest. You know that bubbling sound you can hear? That isn't something that's gonna be easy to get rid of. I suspect there's no way that they'll let her out of hospital when her chest sounds like that.
What does Mrs. Haywood sing then? What does your mum sing?
No, I ain't supposed to yet. I'll go next to her.
Couldn't I treat her down?
She's very poorly, Ron. She's really, really poorly.
It's very difficult because we're not doctors. We can't diagnose. We just go on the way the patient presents. If they don't look well, go into hospital. If their numbers aren't well, they go into hospital.
His mum's his life. She's just absolutely lovely. You couldn't wish for a better neighbour. They've got a lovely family. Ron's golden, Mrs. Haywood's golden. She's just a good friend.
All right, Gladys. Okay, my love.
Could be pneumonia.
On your arm over here.
And I know he's going to be sad now because he don't want his mum to go.
Yeah.
Ta-ra, Mrs. Haywood. I can't hear me.
You fall behind.
There's a high chance that she's not going to come out of hospital.
I'll see you again, Mum. You all right?
For her son, he was the best part of 70 odds as well.
How do you feel?
Not to be able to come up.
You're all right?
Yeah, it's a bit hard when you see that. When the person's quite accepting and thinking, like, I don't think they quite know the sort of degree of how unwell their mum is.
We'll look after her, Rob.
He definitely didn't.
All right then.
Take care, Rob.
Those moments are a bit crap.
Hello. Hello. How are you?
Oh, I'm all right, thank you. How are you?
I'm good.
Have you had a busy day?
It's been steady. We've been all over the place, really.
Yeah, make sure you've had something to eat.
Yes, I have eaten. Yeah.
Chicken and rice?
No.
Come on then, Tia. See Robin?
She always looks so cute. How's Dad doing?
Dad's fine, yeah. He's still working from home, but he's getting fed up of being at home.
Yeah.
Aren't you, Dad? Yeah. So what time are you at work tomorrow then?
I'm on a 10 till 6 tomorrow, and then I'm on my normal nights, 6:15s. Yeah.
Missing you, darling.
Yeah.
Okay, I'm really, really proud of you. All right, everybody's proud of what you're doing, but I am really, really missing you being at home.
I do miss you so much.
Yeah. Oh, don't start. You'll have me start.
I know. We're both as bad as each other. It's.
Okay. You're all right.
Yeah, I'll be okay.
All right, are you okay?
Yeah, I'll be okay, Mum. Yeah.
All right then.
Yeah, don't worry.
All right then. Bye.
Okay. Bye-bye.
Thank you.
Bye.
Bye.
All I want to do is go home and give my mum a massive hug, but I can't. Yeah. That's what I hope I'm at now, but... sorry. As much as I love my job, it's turned my life upside down at the moment, so, yeah. Yeah. This is a patient breathing?
Yeah.
Conscious and awake?
Yeah.
What's the address of the emergency? You're struggling with your breathing?
I am. All my neck's got really swollen all the one side of my neck.
Are you concerned about the coronavirus at all?
I think so. I don't know. I'm just woke up.
Have you been bleeding any red blood very heavily from anywhere?
No.
Oh, okay. My friend, she sadly passed away with COVID-19. She was quite young. Okay, just try and stay calm for me. She had no medical conditions. I'm getting you the help as soon as I can.
I know.
Oh, okay. She was a nurse, a frontline worker. Her dream was to become a nurse and to help people, which she accomplished last year. So she graduated last year, and she was a nurse for a year. Okay, that's fine. Just control your breathing. The more you're going to get distressed, the more you're going to struggle with your breathing.
Yeah.
Just try and stay relaxed and just concentrate on your breathing for me. I wasn't able to go to her funeral. Physically, you can't see anybody, you can't hug anybody. That's been hard. I'd seen her 2 weeks before. I would still remember seeing her in the shop and, talking to her. Okay, are you struggling desperately for every breath?
It's just the one taking them in.
Oh, okay. She was lovely. Oh, God, I can't talk. I've arranged the help for you. They're going to be with you as soon as they can, okay?
Okay, thank you, bye.
Now it's coming up to 11 o'clock when we join people across the country in falling silence to remember those frontline workers who've lost their lives to coronavirus. Today, on what is International Workers' Memorial Day, we pause and reflect.
Stack yourselves in between all the gaps, guys. Okay.
There are 2 meters in there.
Guys, just come along the front here and just sew.
Today, there's a minute's silence to show all of our gratitude for all of the NHS staff and other care staff that have terribly, sadly lost their lives as a consequence of caring for others and helping others. So I'll be leading our staff and showing our appreciation of everything that all of our colleagues right across the NHS and social care have been undertaking over the last few months.
Got a minute yet, guys.
I think it's more an opportunity to reflect on the impact it's had on those that have sadly lost their lives and their family and their colleagues. So I think it's right that we all come together in a way that I think the British people are really good at, actually.
Ambulance service, is a patient breathing?
Yeah.
Is a patient conscious?
Say again, sorry?
Is a patient conscious?
Yeah.
And what's the reason for the call?
She poured hot water on herself. She's only 18 months old.
Okay, I'm just getting some help to you now. Don't move her from where she is. If she becomes unconscious, you need to make sure you're rolling her onto her side, okay?
Okay.
So you said it's with water she's got burned?
Yeah, well, making a cup of tea, she just tipped it on herself.
She's dropped a cup of tea on herself, okay.
Yeah.
Before doing anything else, I need you to cool the burn down with cold, running water for at least 20, but no more than 30 minutes, okay? If there are any new symptoms or if she does get any worse, anything changes or you have any other concerns, you need to make sure you're giving us a call straight back on 999, okay?
Okay, thank you.
The ambulance crew will be with you as soon as they can. When the minute silent happened, I was on a call. It was upsetting knowing that I didn't do it. I'm still working through it because I can't see her family or can't meet people. I can't hug somebody to explain my grief, I suppose. I'm very proud of my friend. She was very special for the job that she did and how she did it.